Good evening, viewers, and welcome to this edition of Daybreak News, where I'm having an exclusive interview with Dr. Frank Anthony, the Minister of Health for the Cooperative Republic of Guyana. And the issue we will be discussing, as much as the main issue that should be discussed at this point in time with the Minister of Health, should be the pandemic and what is going on and how they're dealing, how his ministry is dealing with this. Unfortunately, we have to discuss a no confidence motion brought by an opposition who, when in government, was brought down by a no confidence motion. Sad to say, that is what we are discussing. Dr. Anthony, good evening, and thank you once again for this opportunity to give Guyanese citizens a better understanding of what could only be considered to be funny, and it should not be at this point in time.
Well, thank you very much for having me on the program. And as you rightly said, if the pandemic wasn't as serious as we know it is, then this whole episode with Mr. Harmon and what he's trying to do would be a very funny exercise. Unfortunately, we have work to do. We have lives to save. And this type of gymnastics that he's engaged in, he probably got a lot of time on his hands, which we don't have, because we are seriously engaged in working for the health of people of this country.
Dr. Anthony, as funny as it is and should not be, must be remembered at this point in time, how does this affect you?
It doesn't affect me at all. Mr. Harmon has given us a unique opportunity for us to debate this matter in the Parliament. And of course, we welcome this opportunity to remind Mr. Harmon and the APNU and AFC of the many shortcomings that they have had over the last 5 years that they were in government. And we recall the damage, the destruction that they have done to the health sector. And I have no problem reminding them of all of that. And they themselves, as you would recall, in just that short period of time, would have had, 3 ministers of health? Because they had so many challenges in the health sector. You would recall also that they had some of the biggest scandals that happened in health, which include the bond, the now famous bond, the Sussex Street bond. You remember that?
Yes.
They had the scandal as it regards to drug shortages, where they've spent close to $35 billion in drugs and medical supplies. But across this country, there were massive shortages of medicines. And then just recently, when we took over, we discovered that they had more than $10 billion worth of medicine that had expired at the Diamond Bond. And just recently, we had to throw away another $4 billion worth because they procured things, or there were things in there that was expiring. This is the government. This is what we're talking about, their management. So it's a beautiful occasion for us to go back and review what they have done and what we have inherited and what we have to fix now. And despite all of those challenges that they've left us, in a very short period of time, we have managed to deal with the pandemic. We have also started turning around all the deficiencies that they've had in the sector. And then you have this comical exercise by Harmon and team to bring a no confidence motion. So we'll be happy we'll be happy to deal with them in Parliament, and we'll be happy to expose them once again to the Guyanese public so that people can see the incompetence and what they have done and be reminded of what they have done to this country, how much money they have squandered and how they have squandered it, and how many lives they have put at risk. So we'll have an opportunity to deal with that.
Dr. Anthony, to put it delicately, do you think you have been doing all you can, or your ministry, as it relates to addressing mental health issues in this country, since there is no other explanation for the actions of the opposition leader, members of parliament who are in the opposition, other than them going through some form of depression? Could there be some shortcomings with the ministry that's overlooked, that we have people with mental health issues in parliament?
Well, you know, mental health is a big challenge in the country, and certainly there's room for improvement. And if you think there's a little deficiency in our part, I apologize. And we are going to work, you know, steadfastly to try to correct that deficiency.
Dr. Anthony, recently I had an interview with the French ambassador, who was very appreciative of how this administration and yourself handled the pandemic. Reason being, he is the ambassador, French ambassador to Guyana, Suriname, French Guyana, and the Caribbean. That gives him an ideal opportunity to understand, and a unique understanding of what is going on in different countries. Trinidad is on lockdown, Suriname is on lockdown. Fortunately, the method used or deployed by this administration has afforded the opportunity to have the country still open while we fight to resolve this issue by vaccinating the citizens, which for the most part has been going well, again stymied by delusions created amongst the opposition members by the opposition leaders. There is no other explanation. The international community works with you. The American ambassador works along with the ministry and other bodies to bring Guyana out of this pandemic. The opposition works against that. And again, not against the people of Guyana, but their own supporters. How or what can you do to address this issue?
Well, first of all, the pandemic is a serious thing globally. And we have to treat it with that level of seriousness. If we go back to when APNU was in government and their preparations to deal with COVID-19, you would see that they were completely lacking in what they were doing, the thinking about how to manage the pandemic. It was completely lacking. For those first few months when they were there, we had difficulty trying to get a PCR test done. Remember that sometimes when a PCR come into the main reference lab, that it took sometimes 24 to 48 hours, if you're lucky, to get that result. If it was coming from an interior location, it took about 7 days before you can get the results back into the location. Throughout their tenure, on average, they would have done maybe about 20 tests, 21 tests per day. That's hardly enough when you're managing a pandemic. Contrast that just take that alone, and contrast that with what this government would have done. We have now, at the National Public Health Reference Lab, the capacity to do more than 2,000 PCR tests within a 24 hours period. 21, under APNU, 2,000. We have the capability of doing 2,000 in a single day. That alone speaks volumes. But the processing time for a test, when those tests come in, it takes us less than 3 hours for us to get back those results. And so when you look at what they were doing and what we are doing, you can see a tremendous difference. But it's not only PCR tests that we are doing. We also have been able to procure what is called antigen testing. And almost every regional hospital, district hospitals, we have deployed antigen testing. Those tests, you can get back results within 20 minutes, 20 to 30 minutes max, and you'll be able to know whether somebody is positive or not. We also bought equipment that is called Gene Expert equipment that we have deployed to all our regional hospitals in the interior. And what that is helping us to do is that if somebody, we suspect that they have COVID, they can get a PCR type of test done at the hospital and get back those results within an hour. Contrast that with when APNU was there and it took 7 days for you to get back results in an interior location. So when you think about testing alone, it shows the big contrast in what they were doing and how they were managing and how we have been able to manage and speed up and expedite the time for testing and the processing and all of that and getting people their results. During their period, you know, when we look at PPEs, personal protection equipment, you would recall that people across this country, healthcare workers, did not have access to masks, whether it's a surgical type or the N95 mask, which was even harder to get. They did not have access to it. They did not have access to face shields. They did not have access to hair covers. They did not have access to gowns. They did not have access to shoe covers. Most of these things are disposable. When you wear them, you have to throw them away. Again, we have changed that. We have literally bought millions of these things and have been distributing it to all our healthcare workers. So again, when you talk about the protection of people who are working in the health system, this has been a contrasting difference between our approach to protecting health workers and the APNU AFC's approach. Then we can look at other areas of COVID management. So for example, our regional hospitals did not have ventilators because the APNU did not bother to buy ventilators for them. So if you had a person who was extremely sick and needed to have some form of ventilation being done, if they didn't make it out to Georgetown, they basically died at that regional hospital because they didn't have a working ventilator. We have put ventilators in every single regional hospital. And for those hinterland hospitals where there's a challenge to get oxygen, we have put something, a machine called an oxygen concentrator, that would take normal air and convert it into oxygen. And each one of those regional hospitals now have those oxygen concentrators, which allows us to save lives out in the region. We can also talk about treatment for COVID. So again, when we came to office, many of the doctors, there weren't any type of protocol as it relates to treatment for COVID. Guyana did not have standardized treatment protocols. We implemented, we drafted, we put those things together and train all of our doctors who are managing patients with COVID so that you can have standardized treatment for patients across the system. More recently, maybe about a month and a half ago, we had another such training. And this training was done with the help of the Pan American Health Organization, so that all our doctors who are managing COVID patients can know what to do and every step of the way. So whether it's at the beginning, whether somebody got hospitalized, what to do when they're hospitalized, what are the signs and symptoms to look for, if they start deteriorating, what else you need to do. So there's a step-wide approach to how you manage these patients. Under the APNU AFC, where were those protocols? Where was the step-wide management? And you obviously would recall that they were building a so-called hospital at Ocean View. But when we got into government, it was literally a shell. But Mr. Granger and Mr. Harman, they commissioned that place twice. I think they changed the name 3 times. But when we got in and we looked at what was there was so much work that we had to do to complete that facility and operationalize the facility. So although they were thinking about doing this as a hospital, they did not have electricity, did not have water, the sewage system was not connected. Apart from all those infrastructural types of problems, when we look at the system in there that they had to separate patients and so forth, none of that was in place. We then had to put in, apart from addressing all those issues, we had to develop an ICU area so that we can treat patients who require ICU care. We had to buy beds for it. We had to buy ventilators, the monitors, everything we had to put in place. We have spent millions of dollars to make sure that that place becomes functional. In addition to all of that, we had to put in an oxygen system so that people who are coming there can get oxygen. And the doctors and the nurses who have to work at that hospital, if you're planning to open a hospital, don't you want to find out where you're going to get the people to operate the hospital? They didn't have any plans for doctors, for nurses, for the personnel that you need there to operate such a facility. Not a single plan. Not a single person was recruited to do the medicines at that COVID, to administer medicines or to look after patients at that COVID hospital. So, it's going to be fun when this thing come up for debate, because we can clearly contrast what they were doing with what we were doing, we are doing, and how that differs. And because of the actions that we have taken, that is why we have saved so many lives. That is why we have, in many ways, curtailed what could have been a disaster. So there are many things that we can talk about, and I'm sure we will get around to that. When you look at our vaccination, what we've been doing with vaccination in this country for COVID-19, we have been very, very aggressive with getting people vaccinated. The government spared no efforts in trying to secure vaccines, and instead of going to COVAX alone, we went out to several places looking for vaccines. We got donations from India and China. We got donations from COVAX. We were able then to purchase vaccines, the Sputnik V, and we also purchased the Johnson & Johnson vaccines, which we should be getting shortly. So we have spared no efforts in terms of getting vaccines for our people. And this is very important. As soon as we got those vaccines in, we started to administer them to help to protect people. The first set of people that we gave vaccines to were the healthcare workers, because they are on the front line and we wanted to protect them. So the first 3,000 doses that we got went to those healthcare workers. And then as we got in more vaccines, we started to give to other categories of people. It is extremely unfortunate and borders on criminal intent when an opposition would try to undermine a vaccination program that is aimed at saving people's lives. We are in a pandemic. There are many countries in this world that would like to get vaccines to administer it to their people.
Opposition, by the way, Dr. Anthony, that are all vaccinated.
Well, some of them in the leadership, but they have been encouraging people, their supporters and others, not to take the vaccine. And that is criminal, because this vaccine is saving people's lives. And when you have people actively going out and telling people not to take the vaccine because it got this and it got that and it will make you this and it will make you that, that is spreading disinformation and is putting those persons who would be listening to them and taking that advice at risk. You know, right now in the COVID hospital or the Ocean View facility, no person who has been fully vaccinated has died from COVID. We haven't had those persons coming to the hospital. And if there's any evidence that people want, that is the evidence why vaccine is working. But you have, if you continue to encourage people not to take vaccines, you will see them, you'll eventually see them at the COVID hospital when they get infected, because they will get the more severe form of the disease. If you're vaccinated, you're protected. And even if you get infected with COVID, you are going to have a milder form of COVID. So, in any country with a sane opposition, what would happen is that that opposition would join forces with the government to ensure that the nation as a whole, the people in that country, would receive their vaccination. What we have here is an irresponsible bunch of people who only look after themselves. We have seen it when they were in government, and we are seeing it now when they're out of government, because many of them in the leadership came and they took the vaccine, but now encouraging people not to take it. When Mr. Harman went on the media and said to people, suspend the vaccination using Sputnik, is Mr. Harman a medical doctor? Does he know what he's talking about? Does he even know how vaccines operate? No, he doesn't. But he go out there and make a wild statement. Y'all don't use the vaccine, suspend it.
Which he had to then retract after.
And I don't think he has retracted it, because, you know, this is the kind of irresponsibility that we have. This is the level of irresponsibility.
Dr. Anthony, I know a lot of times governments in an attempt to be politically correct, and because of bureaucracy, cannot say the kind of experience they're having internally. But I want to ask the question, has this administration been having any problems after the deliberate attempts to scandal the Sheikh who helped us to get the Sputnik? Has this administration been seeing a different response from people when reached out to get vaccines?
You're always going to have challenges, because now that the opposition has made such a big deal over this, where there's none, they're just creating problems. You are going to have problems internationally, because people are going to look at our country with a different perspective. Nevertheless, we as the government, we are committed to getting vaccines into this country. And despite the negativity coming from the opposition, we are going to overcome that as well. And we're working to overcome it. So I want Guyanese to know, vaccines is not going to be the problem. Right now we have enough vaccines here for people. We have brought in 100,000 doses of Sinopharm vaccines. That is good enough to give 50,000 Guyanese first and second dose vaccine. We have currently in country about 100,000 doses, that's recently that we got, of the Sputnik V vaccine. We have used some of it, we have the rest. This is all first dose, and we are working now to make sure that we get the second dose. There is a global shortage of second dose. Why? Because Sputnik V vaccine has been very effective against the Delta variant that is now causing resurgence in other places in the world.
And very serious, by the way.
And very serious surges. In Russia, where this vaccine is being made, there are surges in Moscow and other places, and rightfully so. The authorities there have stopped a lot of the export of their vaccines and have concentrated to protect lives domestically. And in other countries as well, we are seeing similar things. But nevertheless, as the president had said before, we are committed to vaccinating our countrymen, and to make sure that those who receive first dose Sputnik will get second dose Sputnik. And just so that people are very clear, after your first dose, you have up to 12 weeks to get your second dose.
3 months.
3 months. And most people have not met that 3 months as yet. And we are committed to getting vaccines in before that 3 months period.
The Sputnik V vaccine.
Right, so that people can get their second dose. So we're working on it, and we're committing to that. We also have AstraZeneca vaccines here. We have given out the AstraZeneca vaccine first dose, and for those persons who have received their first dose, we also have their second dose that is ready. So if you had a first dose AstraZeneca, you can come and get your second dose AstraZeneca now. Look at that our vaccination program. Despite all the challenges that were thrown at us by the opposition, we still have so far about 48%, almost 49% of our population, the adult population, receiving first dose, a first dose vaccine, which is relatively high to many countries. And when you look at our second dose vaccine, those who have received both doses, we are at 20-something%. That is also relatively high. When we look at other countries in the region, they're having challenges sourcing vaccines, and they're having challenges even when they source, to make sure that they roll out this system. Something that I think people take for granted. Some of the vaccines that we're using require that we store those vaccines at -20. So that when we distribute it, if we're taking the vaccine from Georgetown and carrying it to, say, guns, must be maintained at -20 degrees. If we're taking it to Mabaruma and even further afield, to Imbatero or wherever, it's still got to be at -20. And we have not neglected a single region in this country. Every region in this country would have received vaccines. Every region in this country, the remotest corner, we have gone to take vaccines. And that we should celebrate, because we have professional people that would get up at 4 in the morning, go to that Kingston barn to collect vaccines and to take them out and put them into containers, then travel with it to the airport at Ogle and dispatch it, and then we have teams that are receiving it in different regions to take it out to those communities around this country. And instead of applauding that work of the professionals in this ministry, what we have is an opposition that want to take away from that want to tell people don't go and get their vaccines, and by so doing are going to risk a lot of people's lives. Where is that going to take us? Is that the kind of opposition that we need? Is that the kind of people that we need in politics in this country? Obviously not. Because if you're in politics to look after the welfare of people, then you would join with the government and make sure that everyone take their vaccines. But if you're not interested in people's welfare, then you would be doing exactly what Harman and Company is doing. And that is running around the place, mouthing off all kinds of nonsense, and this is what you're going to get. You're going to get increased vaccine hesitancy, and we have seen some of that. So, you know, I welcome the motion that they've put there, because it would give us in the government a lot of time to talk about their records and what they have done. And we have no problems with comparing our record and what we have done. Because what we have done in the last several months is far more than they have accomplished in the last 5 years that they were in government. In several months, we have done more than they have done for all those years. And we are correcting the deficiencies that they have had in the system, and even they're not just correcting, but making sure that people are getting better service. And that's what this government is committed to. So when they run around with all kinds of nonsense, we are busy doing work. And you can see in every ministry, every single ministry, every single day, we are out there meeting people, hearing real problems that people experience, and fixing those problems. We recently had a flood. Do you recall that? Have you heard about anybody dying from any drowning? Have you heard about anyone who would have had waterborne diseases?
Leptospirosis and a number of different...
Right, leptospirosis, acute diarrheal diseases? No. Why? Because again, while managing the pandemic for COVID, we were also on the ball looking at all these issues relating to flooding. Have we seen an increase in malaria cases in some of the interior area? No. You know why? Because under this government, we distributed close to 95,000 insecticide impregnated bed nets in Region 1, in Region 8, in Region 7, and in Region 9. And that has prevented the spread of malaria, things like dengue, all these mosquito-borne diseases, we have been able to contain it because we have distributed bed nets. So there are many, many things that we can talk about in the sector that we are working on. But, you know, this wouldn't be of, I guess, interest to the APNU people. But what they should think about is that with a better healthcare system, many of the challenges that people across this country would have, whether it's diabetes, hypertension, all of that, we are making sure that when you come to your health center, that you can get those medications. Before, under the APNU, when you come to the health center and you were given a prescription, you had to go and buy it. You had to take money out of your pocket to go to a private pharmacy and buy it. So when you come now to any one of the health centers and you get your medication, that is money that you're saving. And we are committed to that. We inherited shortages from the last government, from Harman and crew, and we are correcting that. And we are committed to making sure that we fix it. We have spent billions of dollars already in fixing it. And once we fix it and we are at 100% delivery, we are going to maintain that. So yes, we have a lot of things to talk about. And I'm happy that Mr. Harman is going to provide me with that opportunity to talk about all these things so that the people of this country would have a fair idea of where we are coming from, what we have done, and what more there is to be done. Because we are not done here yet. Because when we unveil some of the plans that we have in train and what we'll be doing, how we are going to modernize and improve the health sector, I think you know, people will get a different perspective of how to look at health and what is in store for this sector and for this country as a whole.
I'm hoping to see that in the very near future. Dr. Anthony, I walked in and you're doing work, and I know there's a lot of work to be done to save lives and bring the health sector up to par in this country. I want to touch on two more points before we close off. The pandemic has a new development, one that affects us psychologically more than the pandemic itself, because of the fact we've now realized that our children are being affected. What is the ministry's plan, and what do you have to tell parents?
Well, since the pandemic started here, since we recorded our first case, we would have seen close to 1,600 children who were infected with COVID-19. And this ranged from newborn right up to, say, age 16. And most of those cases have been mild, meaning that children got infected and they're, you know, they're going to get better very quickly.
By the way, Dr. Anthony, anybody of any age that comes into contact with an individual who is infected by COVID will be affected.
Exactly.
Children have adapted differently because of their high immune
their
resistance.
Their immune system is a little bit immature, so it doesn't affect them as much.
Okay.
But it doesn't mean that they're not infected.
They're not infected.
So once you're exposed to someone with COVID, you are going to get infected. So that's the first thing. And we have seen children who've been infected. We have spoken about this before. You will recall on many occasions when we brought back children to the school, we have tested them in the dorms, and we found a lot of kids who were positive. We had to isolate them before we allowed them, you know, to continue to mix with the others. So that has been ongoing. But last week, we had something that was a bit disturbing, where we had at least 4 children who were hospitalized. We don't see hospitalization of children very often. So when we saw that, that was very disturbing to us. Nevertheless, as of now, we still have 3 children who are in the hospital. one in the ICU, and the two others are now in the regular ward. And that's a good thing because we have
Are we speaking about the same 4 children?
right. And one has been discharged.
One has been discharged.
2 are now in the regular ward, and 1 remain in the ICU. So we have seen that with the help of the medical team that is managing these kids, that they have been able to get them to do much better. They have recovered, or they're recovering, and the prognosis looks good. But we'll continue to monitor them and make sure that they get the best care that we can give them. The child that is in the ICU, we have that child is still critical. We have to manage that child. Now, why that was disturbing? Because hospitalization in children is relatively rare, and there has been a syndrome that we have observed in children called multisystem inflammatory syndrome, and we were observing to see whether that is what is occurring, because if that is occurring, then we know there is some level of seriousness. These 4 children that we have in the ICU, or had in the ICU, they have various underlying conditions. So we have a child who has cancer. We have another child who is asthmatic. We have one child who has some form of pneumonia. And we had one child who had sickle cell. So each one of them had varying underlying conditions. And with COVID, it created more problems for these children. But I'm very happy that the medical staff, professional staff, work very closely with them. And so, as I said, one has been discharged, and we have 2 others who are recovering, and one still in the ICU. So we have to continue to monitor these children. But also, given that what we are seeing in other countries, where there emergence of variants, and in some of those countries, we have also seen that children, because they're unvaccinated, and because right now there's only one vaccine that is available to children, and that is the Pfizer vaccine. So in most countries, children are unvaccinated. And with the new variants, we see that it is affecting children. So that's something that we are monitoring closely. And it is something that we will continue to do to make sure that we can, see what is going on with the epidemic. But while we are doing that, every parent can take action. And that is, you have to reduce the contacts of your children. You can't put them in an environment where they are going to be exposed. And even if they have to go out, the same rules that we're asking adults to have, where they should have a mask on, keep some distance, sanitize their hands, those simple rules are also applicable to children. And so we have to work with them to ensure that, they understand the importance of doing these things. And hopefully, as we work with parents and get this message over, I'm hopeful that we wouldn't have so many cases.
This is to all parents. In light of the fact that the children who were admitted to the hospital all had underlying issues, of which most parents would know, is there any special request of parents who are aware that their children would be asthmatic and these kind of things? Would you be asking them to take special interest with these kids?
And that's a very good point, because children who would have these underlying conditions, as we call them comorbidities, parents should take that extra precaution and protect them, make sure they have on masks and things like that. Asthmatics, you have children who are diabetic, they require insulin. So you have children who the parents would know because they have been diagnosed with these underlying issues.
Those parents should take extra precaution.
They should take extra precaution.
Dr. Anthony, earlier in this interview, you listed a lot of items and equipment the government would buy to bolster this fight in the pandemic, bought in bolstering this fight. What has this government done as it relates to due diligence and transparency to ensure that we don't have a reoccurrence of sex toys being bought for testing?
Look, there are a couple of things that we're doing. First of all, there are lots of equipment that was in poor condition, terrible condition, and we are trying to address that. In Berbice at the New Amsterdam Hospital.
Just before you go in, Dr. Anthony, just to ensure that for the viewers who did not or were not aware what transpired, your ministry, before you became the minister and before the PPP administration came into power, the health ministry bought a sex toy for testing on patients. It was found that a sex toy was bought. Am I correct?
Yes, for whatever reason, a toy was bought, but I don't know who procured it. You had another case where for the anesthetic machine, they bought an anesthetic machine that is for veterinary medicine, not for human medicine, veterinary medicine. So this is an anesthetic machine for dogs and cats and so forth, and that was bought for one of the hospitals. You had another case where they had to get certain seals, that when you do certain procedures, those are specialized medical seals. And the person who procured those seals bought seals for the regular pump. So there are many things like that that we inherited.
No, but what has this administration put in place to ensure it doesn't reoccur?
So a couple of things. One, the equipment that we are buying, we are trying to standardize those equipment to make sure that they comply with certain international requirements. So we have a committee in the ministry that is working on the standardization of all these pieces of equipment. So whether it's X-ray, whether it's ultrasound, these are things that we are doing. In addition to that, we have a very rigid procurement process. And so while request comes from, say, health centers, hospitals, and so forth, that is screened. Then it goes through a process of the procurement team looking at it, doing the specs, along with the technical team. And then we put that out for a public tender, so people can review and see what we have. And once that process is completed, then we'll have people tendering, and we'll see who put in the best bids, and they're evaluated, and those best bids would get the award. So we have been going through quite an elaborate process to make sure that we have the highest quality of equipment, and we'll continue to do so. So hopefully those mistakes that we've had in the past would be something in the past.
Dr. Anthony, I want to thank you for this opportunity to bring clarity and bringing clarity to a number of different issues, specifically the one where a no confidence motion has been brought against yourself and the Minister of Home Affairs. It's glaring because of the fact that it is only two ministers. So the opposition has accepted they have found fault in two ministers. There is some bit of shortcomings. We have to hear what that is. I'm supposing the people are waiting to hear. And a successful no confidence motion was brought against the opposition when they were in government against all the ministers. And they were brought down by that. Yeah. So I think the Guyanese citizens should see the contrast, because the opposition has accepted at this point in time where there's a pandemic, has been a major flood, and a number of different issues, political instability, much of which they create, I think it shows that they have accepted now that there are two people we have issues with. The government in general is okay. I'm hoping you could bring clarity again in Parliament and deal with these issues and bring back confidence, as you have said, that it doesn't really bother you, but Guyanese want to know and be reassured that the person who is looking at the healthcare sector, who heads up the healthcare sector, yourself, is on a positive note, since that is going to transfer to Guyanese and how we come out of this pandemic. So I want to thank you again.
Well, thank you very much for having me. And, you know, I welcome the opportunity, whether it's on your program or in Parliament, to, you know, to give information and to talk to people, to educate people in many ways about what we are doing, and also because this pandemic is relatively new, we are learning so much about this particular disease that people might have questions, and I don't mind answering those questions. And in the past, I actually spent an inordinate amount of time on obvious questions that parliamentarians might have asked me, for the single purpose that I genuinely think sometimes that they don't know many of these things, and it's an opportunity to educate them. So I would assume that in this opportunity that the opposition is presenting to us, by coming with a no confidence motion, is another opportunity for us to help to educate them, to get them to have a better understanding of how bad, how incompetent they were when they were administering this country in the various sectors. So it's an opportunity to remind them of that. And also it's an opportunity to show them what is possible with good and competent management. And so we welcome those debates, and I'm sure that in those debates, it is a foregone conclusion who would win the debate. So I have no problems whatsoever.
Dr. Anthony, thank you again, and I hope you can be go forward with the best interests of Guyanese at heart. Viewers, thank you for tuning into Daybreak News.